Hello, this is Dr. Lee Gross from Epiphany Health. Today I want to talk to you about self-testing for a nasal swab for coronavirus. As you know, we're currently in the middle of a pandemic, and the supplies for safety for testing for the healthcare providers is somewhat limited. So the Centers for Disease Control has issued new guidance on how to provide testing for patients without the providers having to go through lots of personal protective equipment. So we can still do the testing and limit the protective equipment. So normally when you're doing a collection for a virus like coronavirus or COVID-19, the test is actually pretty invasive. So when these nasal swabs go in to do these, it's called a nasopharyngeal swab, and it has to go really deep back in there, almost to the level of the ear. You have to go back through the nose, almost all the way back to the ear to get that swab through the nose to the back of the throat. Typically when you do a collection like that, it generates the patients from coughing, and it creates their eyes to water and sneeze and gag, which generates a lot of particles and droplets in the air, which actually creates a high risk exposure for the person collecting the specimen. So, but that tends to be a very accurate way of testing for the virus because it likes to live in the back of the nose. And so what they have recommended is actually doing a less in-depth swab. And so they've done some studies to find out that the accuracy of the test is about the same using a more narrow swab than a very deep swab. So I want to talk about that because if we ask you to come on in, we're going to walk you through the process of a self-collection. We're going to be doing this usually in your vehicle, so you're going to drive up and we're going to hand you a swab. Probably not exactly like this one. It's going to be smaller than this one, but I'm going to use a larger one just so you can see it on the videotape. Plus, I also want to use a larger one because I don't want to use our test kits because those test kits are very limited. So I'm going to go ahead and torture myself with the big one and save the smaller ones for your comfort. So first of all, I want to walk through just a little bit of anatomy. So if you're looking at my nose, and we're going to go ahead and turn sideways, we have that little cartilage part of your nose. You have the hard palate on the top of the mouth, just to kind of give you some anatomy. So if we kind of walk down through here, here's the nose. This is the opening of the nose. And if you look, here's the tongue in here, there's the hard palate. And inside the nose, most people actually don't realize it, but there are actually some bones in there. These are called the turbinates. And you never really know these are there, but as you're sticking a swab back in here, so first of all, we'll talk about how the nasopharyngeal swab, the normal swab, goes in through the nose, goes straight back all the way to the back of the throat, and that's where that swab normally would be. You can imagine how uncomfortable it would be to stick something back that far. I mean, even on just the picture of it, you can see how deep that swab is going. That's a good 3 inches just on the picture alone, and this is not to scale. But normally, so what we're trying to do is a less invasive swab. So we want to swab sort of front of the nose and actually kind of get right back in here to these turbinates, these little bones which sort of stick out in here. These are the levels we're trying to get at. So the nose, we're talking about going in, maybe 1/2 inch to 1 inch, and then probably 1 inch to 1.5 inches to get to these turbinates. So it's a much less invasive swab. Still a little uncomfortable, but a much easier swab for somebody to self-collect. You can imagine how difficult it'll be for you to put this all the way back there yourself. And so we're going to ask you to do it a little narrower yourself. So I'm going to go ahead and demonstrate a little bit. So we're going to start with the nasal swab, and what I'm going to ask you to do when you come in is we're going to ask you to try to do both of these. We're going to start with the nasal swabs because these are easy peasy. Everyone's going to be able to do these. And then after that, we're going to switch to the little deeper swab and hope you can tolerate and get both sides of these. When you do that second one, it's probably gonna make your eyes water a little bit. It's gonna be a little uncomfortable, but it's just gonna last a second. You'll get through it. And then when you're done collecting it, you're gonna go ahead and hand it back to the person, making sure that you're not exposing them to the contaminated end. So first of all, when I hand you the swab, it's gonna be important that you don't touch the tip of the swab. The tip of the swab is sterile. You don't wanna be brushing it against your face. You don't wanna be brushing it against things in your car or your clothing. So this area needs to stay sterile. If you need to flip down the visor of your car so you can actually see what you're doing, that might be helpful. So that's an option for you. But we're gonna start off by going ahead and tipping your head back just a little bit. And you're gonna go ahead and insert straight back. So you almost want that swab parallel to the floor. It's not going up. You're not putting that swab up the nose. You're putting the swab with your head tilted back, parallel with the floor and straight backwards. So that first swab is going to go straight back just a little bit. Again, you're talking about 1.5 inches. You don't want it deep in the nose. It's going to look like that from the front if you're looking in the mirror. And then you want to gently put a little pressure against that swab because you want to brush it against the interior nasal septum and twist it 3 times. 1, 2, 3. You just want a little friction on that pad. You're going to go in on the other side. Again, head tip back a little bit, straight back into the nose, just a little bit, about 1 inch, 1/2 inch to 1 inch. Put pressure on that swab. 1, 2, 3 twists. And now, before pulling it out, you're going to go back and we're going to try to go ahead and do that turbinate swab. So we're going to go back just a little deeper. It's a little uncomfortable, make my eyes water. No need to push that there because it's already past that soft area. And again, twisting it 1, 2, 3 times. Again, my eyes, a little water in there. You might get a little mucus on there. Going back the other side again, head tipped back just a little bit. We're not switching nostrils. Head tipped back just a little bit. Parallel with the floor, not up, straight back into the nostril. Again, being careful not to touch it to your face. We don't want to contaminate it. Going straight back till you feel a little resistance on that. You should feel a little resistance. If you're not feeling any resistance, you need to go back a little further until you feel like it's up against that bone there. And again, twisting 1, 2, 3 times. Again, it's going to make you water a little bit. You're going to go ahead and hand that straight out to the person that's collecting it for you. If they've handed you the tube, what you're going to do is go ahead and stick that into the tube and go ahead and break that off and hand it back out to the people. But if we don't give you the tube, just go ahead and hand that specimen out to people. And it's that simple. So stay safe. Thanks for joining.